What if we told you that childbirth was so risky in early human history that it resulted in more than 20% of women dying? That's right. For most of our existence, giving birth was more dangerous than fighting in war. So just how did early humans deal with such a brutal process? No doctors, no hospitals, just pain. If you were born in the modern era, chances are you had an amazing childhood. You were fed on time, your vaccines were up to date, and you probably had a stable family structure. But unfortunately, this isn't true for everyone. In fact, over 390,000 children under the age of 5 years die every year from preventable causes. So while some children have it rough even now, it was much worse in the past. In the absence of doctors or hospitals, the only thing that women in early human history had to rely on was their community. Even then, these communities would often be nomadic and wouldn't stay in one place for too long. The problem is that childbirth requires a lot of preparation and aftercare, something that early humans didn't have the luxury of providing. Not only that, but back in those days, there were no painkillers either. To make matters worse, childbirth could last for days, not hours. As a result, many women would bleed to death or suffer from severe infections. It was a communal, but risky, event. One of the few advantages that women did have when giving birth was the support of their community. As we said earlier, early human communities were nomadic, which meant that they had to move from place to place in search of food. This, however, also meant that they weren't too far from each other at any given point in time. Because of this, if a woman went into labor, she could count on her neighbors helping her out. Another advantage was that women gave birth during communal events. This gave them the much-needed emotional support to get through the grueling process. These events would typically take place during the summer when the weather was warm and food was plentiful. This made sense since the mother needed to be well-nourished and comfortable during childbirth. Interestingly, childbirth wasn't really considered a private event in early human history. Instead, it was a communal affair. Men, women, children, the elderly, all of them would gather around to watch the birth. This may sound disgusting to us today, but back then it was considered normal. After all, it was a celebration of life. However, while these communal births did increase the chances of survival for both the mother and the child, it also came with its own set of dangers. For example, if someone in the group happened to be sick, they could easily spread their germs to the mother. This would put her life in even more danger and make the whole process far more difficult. Unfortunately, there was nothing that they could do about this. Antibiotics hadn't been invented yet, and even basic hygiene was a luxury. Speaking of luxuries, here's a fun fact. Did you know that only 5% of people on the planet use a credit card? It's true. Most people still use debit cards, cash, or digital payments. However, things will change soon because credit cards are becoming more popular than ever before. With the rise of online shopping, people need a secure and easy way to make payments, and credit cards are the perfect solution. Death during childbirth was common. As we mentioned earlier, childbirth was dangerous and painful. This means that throughout history, many women died while giving birth. In fact, between 10 and 20% of all women died during childbirth. Now, imagine how devastating this would have been for the families involved. Women would go into labor and never return, which meant that their families would have to bury them along with their unborn child. To make matters worse, these burials were pretty basic. There weren't exactly stone hinges built for the occasion. Instead, the bodies would be placed in shallow pits, along with some basic grave goods. Eventually, these graves would be filled and the mourners would go on with their lives. This may seem heartless to us today, but back in the day, it was necessary. This was because childbirth was an extremely common cause of death among women. In fact, more women died while giving birth than from any other reason. During the Middle Ages, the situation didn't improve much. Things started getting better only after the invention of anesthesia. Up until then, childbirth was a very risky process. Even the first European to give birth in the presence of a doctor, Queen Victoria, had to endure excruciating pain. While she did survive the ordeal, many others didn't. Ironically, this changed only in the 20th century when most of the world became urbanized. Before this, rural women had to rely on midwives for help. Midwives were older women who had experience with childbirth. They would assist the mother during labor and help deliver the baby. However, they weren't exactly medical professionals. This meant that they couldn't intervene in case of complications. Fortunately, by the 20th century, most people had moved to cities where they could access proper healthcare facilities. This reduced the number of deaths during childbirth significantly. But the problem is that this isn't true for everyone. To this day, 290 women die every year from pregnancy-related complications. Most of these deaths occur in developing countries where access to healthcare is limited. Childbirth in the Stone Age. Now that we've talked about how childbirth was like in the modern era, the Middle Ages, and the early 20th century, let's discuss how it was in the Stone Age. Giving birth during the Stone Age was perhaps the most difficult and dangerous of them all. This is because the majority of human development occurred during this period. During the Stone Age, the earliest form of human, Homo habilis, appeared on the scene. Over the next million years, they evolved into Homo erectus, who were the first hominids to use tools and fire. Eventually, Homo sapiens appeared and became the dominant species on the planet. All of these developments took place during the Stone Age. This means that childbirth during this period was different for various species. For example, Homo habilis had a brain size of only 600 cubic centimeters. As a result, they didn't face too many complications during childbirth. On the other hand, Homo sapiens had a brain size of 1,350 cubic centimeters. This made childbirth much more difficult. In fact, studies suggest that Homo sapiens had to give birth in a semi-reclined position to avoid complications. Interestingly, scientists aren't even sure whether they gave birth on the ground or in caves. There are two theories for this. One states that they gave birth on the ground, while the other states that they gave birth inside caves. Both theories have their pros and cons. If they did give birth on the ground, it would explain why they preferred warmer months to give birth. However, it would also expose them to the risk of wild animals. If they gave birth in caves, they would be safe from wild animals. At the same time, they'd also be exposed to predators like cave bears and cave lions. One thing is for certain though, childbirth during the Stone Age was risky for both the mother and the child. Even if they managed to survive the process, they wouldn't live for long. The average lifespan of a human during the Stone Age was 30 to 40 years. This is because life was just hard. There were no fancy medicines, no vaccines, and diseases that could be treated easily today were life-threatening back then. For example, a simple cold could easily turn into pneumonia and kill you. A painful process. As you can see, childbirth has come a long way since the Stone Age. Back then, it was a painful and dangerous process that resulted in the deaths of thousands of women. But today, thanks to modern medicine, it's much safer. In fact, only a small fraction of women die while giving birth today. However, this isn't true for everyone. In some parts of the world, childbirth is still dangerous. This is why we should be grateful to live in a time and place where we can access proper healthcare facilities. At the same time, we should also try and help those who don't have the same privileges as us. Who knows? Maybe one day soon we'll be able to completely eradicate the dangers of childbirth. The process of giving birth is painful. Even with access to modern medical care, childbirth is still dangerous for both the mother and the baby. But life was much more difficult thousands of years ago. And unfortunately, there was not much that could be done to ease the pain or increase the chances of survival. So how did early humans handle childbirth? Let's find out. They didn't understand what was happening. Today, we know what causes labor pains. We know it's because the baby is trying to move from the womb into the outside world through the birth canal. The contractions help the baby descend into the vagina. The cervix expands to allow the baby to pass through. The uterus itself is a muscle. When it contracts, labor pains occur. We also understand why these cramps are so painful. The ligaments and tendons in the area are being stretched to their limits. As all this is going on, hormones are released that make the whole process even more uncomfortable. But did early humans understand any of this? Most likely not. Just because something happens regularly doesn't mean people understand why it's happening. For example, day and night happen every 24 hours. But some people who live far away from cities and don't have access to electricity may not know why these cycles take place. Instead, they will come up with other explanations for the changes between darkness and light. The same was probably true for childbirth. Imagine sitting in a dark cave with no knowledge of what your body is going through. All you know is that you feel horrible. No doubt childbirth would have been explained by myths and legends, which are often used to explain the unexplainable. These stories would have been passed down from mother to daughter, and each generation would repeat the same misconceptions. Since we don't have written history from that long ago, we can only imagine the types of theories that might have been created. Perhaps early humans believed the pain was punishment from the gods. Maybe they thought evil spirits were trying to enter their bodies. Or maybe they truly believed their insides were literally being torn apart by some unknown force. Whatever they thought, it must have been terrifying. This lack of understanding would have made the entire experience much worse for those in labor. Tools were crude, if used at all. In modern times, many tools have been invented to make the birthing process easier. First, you have the standard hospital bed. This allows you to change positions and receive pain medication. You can be moved from side to side or even lifted into the air if necessary. It makes the job of the obstetrician much easier too. There are special lights that can illuminate the area and suction devices that can remove fluid or blood. Of course, the most important tool is the one that helps the baby come out of the birth canal. Depending on the situation, an obstetrician may use forceps or a vacuum extractor. Forceps are basically a pair of tongs that are attached to the baby's head. The vacuum extractor looks similar to a cup that is attached to the baby's head. Both of these tools reduce the need to push and help bring the baby out quickly. Did early humans use such technology? Almost certainly no. After all, humans had been using stone tools for less than 2 million years when our species evolved. At first, these tools were very basic and weren't really useful for anything besides cutting meat. It wasn't until about 10,000 years ago that more advanced tools started to appear. But by this time, most primitive societies were still living in caves and hunting for food. Thus, any type of surgical procedure was out of the question. It's hard to believe that someone in labor would want to stick sharp stones inside their body. They likely wouldn't even know where to find such objects. Some historians claim that women would have used sharp rocks as specula, but there is little evidence to support this idea. A speculum is an instrument that is inserted into the vagina to open it up. The only problem is that no such artifacts have ever been found. Some anthropologists say that early humans would have used sharpened animal bones instead. But this isn't much better. It's unlikely that a bone would stay sharp enough to be useful. Also, it's doubtful that anyone would have wanted to insert anything into the vagina. At best, early humans would have had some sort of smooth rock that they would have rubbed against the stomach. But this is pure speculation. Evolution made it worse. The female pelvis has changed a lot over the course of evolution. Compared to other primates, the human female pelvis is much narrower. This is because the brain has gotten bigger and bigger over the years. Babies with large heads have always been a problem for females. Their narrow birth canal can't accommodate a large cranium. That's why most babies are born prematurely. Their brains have not yet fully developed. Likewise, if a baby is born full term, They usually have to be delivered via C-section. This would have been even more true for our ancestors. Evolution seems to have made childbirth increasingly difficult. Even today, childbirth is more dangerous for females in underdeveloped countries. This is because they have to deal with complications that could be treated with modern medicine. Hemorrhage, infection, high blood pressure, and convulsions are all serious issues during pregnancy. These problems do not always arise, but they can quickly turn childbirth into a life or death situation. If a female survives childbirth but her baby does not, she loses her fertility. This means she won't be able to have children in the future. From an evolutionary standpoint, this is a huge setback. Males can easily reproduce throughout their lives. One male can impregnate many females and produce lots of offspring. Females, on the other hand, only have a limited number of eggs. Each month, the ovaries release an egg, and if it's fertilized, a child can be produced. Once the eggs run out, a female is no longer fertile. So from a purely biological point of view, it would have been beneficial for females to give birth to healthy babies with minimal complications. But evolution didn't really care about that. The fact that childbirth became increasingly difficult may have actually been a good thing. Scientists think that childbirth occurring before the baby is fully developed led to larger brains and smaller skulls. Over time, females evolved to have a slightly wider pelvis, but it was never enough to accommodate a fully grown baby. The result is that females still have to give birth to immature babies. The positive side is that giving birth to a premature baby is much safer than delivering a full-term infant. Skeletons show the scars. Historians can learn a lot from skeletons. By examining bones, they can determine someone's age, sex, height, and whether or not they suffered any injuries while alive. It just so happens that female skeletons reveal a lot about childbirth. The pelvis is the main area of interest. If a female gave birth multiple times, the bones in her pelvis would be worn down. Certain fractures can also be indicative of childbirth. Some of these are obvious, like an old injury to the pubic arch. Other signs are not so apparent, like a hole in the sacrum. Unfortunately, scientists haven't discovered many ancient skeletons with pelvic fractures. Most of the skeletons that have been found either belong to males or the bones were damaged after the person died. Some of the most convincing evidence of childbirth comes from the edges of the pelvis. During delivery, the bones are pushed apart. This can cause small flakes to break off the ilium. Fortunately, the body is capable of healing these injuries. The only problem is that sometimes the healing process goes a little too far. Extra bone can grow around the fracture, and this creates small bumps on the skeleton. These bumps look like small bruises, and they can be found on the surface of many ancient bones. What's interesting is that not all females have them. This suggests that childbirth was still dangerous for mothers, and not all women survived the process. The few skeletons that do show signs of these small bumps tell us a lot about the birth process. For example, we know that women who had these bumps had given birth at least once. We also know that they survived the ordeal. Finally, the injuries suggest that the babies were probably born feet first. The male pelvis has a heart-shaped opening, while the female pelvis is more oval. This shape allows the baby to be born in different positions. If the baby is positioned vertically, it can be born feet first. If it's positioned horizontally, the baby can be born head first. Scientists have examined several skeletons and found that some of them show signs of babies being born feet first. It's possible that some babies were deliberately extracted this way, but it's more likely that the mother simply couldn't push the baby out in any other orientation. The birth canal was just too small. Another interesting piece of information that scientists have learned is that ancient women gave birth to their first child sometime between the ages of 16 and 18. The reason for this is that younger girls had not yet fully developed. Their bones were too thin to withstand the stress of childbirth. Older females had more robust bone structure, but their pelvic floor was weaker. It appears that nature gave young females the perfect balance of bone strength and flexibility. The pain of childbirth is something that has been experienced by every human female, for as long as our species has existed. But it wasn't until relatively recently that we started to take steps to make the birthing process a little more comfortable. So what was childbirth like for early humans? It was brutal. Giving birth is dangerous. Even today, with all of our modern medical technology, things can go wrong and both mother and baby can end up dying. Back before we had painkillers and antibiotics, the odds of survival were much lower. But our ancestors didn't have the luxury of being able to call 911 and have a team of doctors rush to their aid. So, they developed their own techniques for handling childbirth, which often took place out in the open with absolutely no pain relief. But first, some preparation was needed. In many cultures, the expectant mother would need to be isolated from the rest of the community for a period of time leading up to the birth. For example, the Kung people of the Kalahari Desert would send the pregnant woman off to live in a bush hut by herself for up to 2 months before the baby was born. During this time, she would be cared for by an older female relative who would bring her food and water. This was done to protect the mother and baby from harm, but it also ensured that the mother was completely rested before giving birth. Once labor began, the mother would typically give birth while lying on her back with her legs spread open. This position made it easier for the baby to be born and also allowed for better access to the mother's genitals. The baby was then delivered by a midwife, typically an older female who had experience with childbirth. The baby was first pulled out by its feet, which may sound horrifying, but this actually reduced the risk of the baby being injured. The umbilical cord was then cut, and the afterbirth was expelled. For the mother, the pain of childbirth was just beginning. She would then need to give her baby a massage in order to get rid of any remaining blood or mucus. This also helped to stimulate circulation and prevent infection. After the massage, the mother would need to wait for the placenta to detach from the wall of the uterus. This could take anywhere from a few minutes to several hours. Once the placenta was expelled, the mother was considered to be clean and ready to rejoin the community. Of course, this is just a very basic overview of the birthing process for early humans. The specific practices varied depending on the culture and the time period. For example, in some cultures, the father or another male relative would be present during childbirth to provide support. In other cultures, the mother would be the one to give birth alone without any assistance. Despite the danger and the pain involved, childbirth was seen as a positive and empowering experience for most women. It was a time for the community to come together and support the mother as she gave birth to the next generation. It wasn't until relatively recently that we started to view childbirth as something negative and scary. This is likely due to a combination of factors, including the medicalization of childbirth, the lack of control that women have over their own bodies, and the patriarchal views of women as property. Today, there is a growing movement to make childbirth more positive and empowering for women. This includes things like providing women with more control over their own birthing experience, as well as making childbirth education and resources more widely available. In conclusion, childbirth for early humans was a truly brutal experience, but it was also a necessary one. It's only through the process of giving birth that our species has been able to survive and continue on. While the birthing process can be dangerous and painful, it's also a testament to the strength and resilience of the human spirit. Now it's your turn. What do you think about the early humans' birthing process? Let us know your thoughts in the comments below. And if you enjoyed this video, don't forget to subscribe so you never miss another one of our videos.